Welcome to Backus Health Beat, your source for health news and information. In honor of National Patient Safety Awareness Week, we continue our conversation with Dr. Peter Shea in the second of 3 parts. In this short video, learn about safety during surgery and your role as a patient in staying safe. There are a lot of high-tech surgeries that we do, but whatever kind of surgery we do, I know that there's checklists and protocols and other things in place to keep patients safe. Can you explain some of those?
Yes, it's a process that actually starts before the patient even comes into the hospital. When a patient's booked for surgery, we have a booking slip, we have a history and physical submitted by the surgeon, and we have an informed consent. And we make sure that each one of those lines up so that the name of the procedure, the side, is it right-sided or left-sided, is exactly the same in each one of these areas, because we want to make sure that when the patient comes into the hospital, we know what's going to happen, and as the patient is tracked through the hospital from the preoperative areas through surgery, that we do the exact right operation for a patient. It seems impossible that you would operate in the wrong place on a patient, but when you have a large volume of people and surgeons doing multiple procedures, errors can happen. And so having some very simple processes in place, checking all of that before the patient comes in, when the patient arrives, actually marking the site of surgery, and that does involve the patient. That involves the surgeon performing the procedure and the patient together mark the spot, and there's an agreement, and that needs to match all the documentation. Again, once the patient gets into the operating room, again, a checklist is looked at, and again, we're confirming that we're doing the right procedure on the right person at that time.
Yeah, that's very important. I think that also plays into a lot of times people know that I work at a hospital and they'll ask me, this question comes up over and over. They ask, I came to the hospital and time after time after time they asked, what my name was, and don't you know who I am by the time I've been there for a while? Why do hospitals do that?
Right. And it does seem very simple and redundant most of the time for patients, but the fact is that we have patients with similar names. We'll have patients who've moved from room to room or switched. I remember a case where 2 patients switched their beds in the room, and so if you're going to identify a patient by their room number, by their bed number, you can make a mistake. And so just having those 2 checks really decreases the chance of a wrong medication administration.
Yeah, I suppose it's certainly better to be safe than sorry.
Right,
That's
right.
for sure.